Welcome to Introduction to Radiology Medical Coding. In this video, we will focus on radiology-specific terminology, an essential part of coding accurately and confidently. Understanding these terms will strengthen your ability to interpret radiology reports and select the correct codes. Let's begin. Section 1, Importance of Radiology Terminology. A solid understanding of radiology terminology is critical for coding professionals. It ensures precise communication and accurate code assignment for diagnoses and procedures. In general radiology, three terms you will frequently encounter are position, projection, and view. These terms, although sometimes used interchangeably, have specific meanings that affect code selection. Section 2, What is position? Position refers to how the patient's body, or part of it, is placed relative to the imaging equipment. It focuses on the patient's posture during the exam. Common positions are listed on screen. Understanding the patient's position is important because it directly influences code selection. Section 3, What is projection? Projection describes the path of the X-ray beam as it travels through the patient's body to the imaging receptor. It is named according to the beam's entry and exit points. The most common terms seen in radiology charts are anteroposterior A, posterior-anterior PA, lateral, axial, tangential, and oblique. Regardless of the patient's posture, the projection refers to the direction of the beam, not the patient's position. Section 4, What is a view? View refers to the specific image captured, combining both the patient's position and the projection of the X-ray beam. Standard protocols often include multiple views. For long bones like the femur or humerus, standard protocol is AP and lateral views. For joints like the wrist and ankle, the standard protocol is AP, lateral, and oblique views. Additional views may be ordered to provide more diagnostic information. These other views have unusual names, but are still considered views and should be counted and charged. For example, a knee X-ray taken to evaluate the joint space in detail can be done in 6 different ways with 6 distinct names. Each one is a view. Section 5, Chart Example. Let's tie this together with a quick example. Sample Report 1 CPT Code 73562 Knee 3 Views, the views AP lateral sunrise. Sample Report 2 CPT Code 73562 3 Views, the views AP lateral oblique. Both examples meet the 3-view knee requirement but use different combinations of views based on clinical needs. Section 6, Directional Medical Terminology. Directional medical terminology is a critical aspect of medical care as it helps to accurately describe the location of organs, tissues, and other anatomical structures. This terminology is based on anatomic position. In medical imaging, such as computed tomography and magnetic resonance imaging, the terms axial plane, sagittal plane, coronal plane, and oblique plane describe the anatomical orientations used to capture and interpret images of the body. These planes are critical for medical coding as they help specify the perspective of the scan, ensuring accurate documentation and billing for the procedures. Section 7, Regional Medical Terminology. Regional medical terminology refers to terms that describe specific areas of the body, such as the head, neck, chest, abdomen, pelvis, and limbs. It can also be used when describing symptoms or conditions that affect only one part or region of the body. Knowing regional terminology can help coding professionals code diagnosed diseases more accurately. Section 8, Technical Radiology Terminology. Next, let's explore technical radiology terminology. These terms refer to specialized tools, techniques, and concepts unique to medical imaging. You'll encounter this language across radiology reports for various imaging modalities, such as CT and MRI. 3D imaging. 3D imaging means creating a 3-dimensional picture from many 2-dimensional slices taken during a scan, usually in the axial plane. In CT and MRI, the scanner takes multiple slices of the body part, one thin layer at a time. Specialized software then stacks these slices together and smooths them out to create a 3D model. This 3D reconstruction helps the radiologist see the body part from different angles, making it easier to find problems like tumors, fractures, or blood vessel issues. For coding, if the radiologist uses 3D reconstruction, it may need to be billed with additional CPT codes like 76376 or 76377. Use 76376 if the 3D images are processed on the scanner itself. Use 76377 if the images are processed on a separate advanced workstation. Artifact in radiology and medical coding. In radiology, an artifact is any unwanted distortion or extra information on an image that affects its quality. Artifacts can make it hard or even impossible to clearly see the anatomy the radiologist is trying to evaluate. Common causes of artifacts include patient movement, like breathing, coughing, or swallowing; metal implants, like pacemakers, dental fillings, or joint replacements; technical issues, like equipment problems or wrong scan settings. When artifacts are present, the image might not be good enough for diagnosis, and a repeat scan may be needed. In coding and reporting, artifacts are usually mentioned under technique, findings, or impression sections of a radiology report. Documentation about artifacts explains any limitations in the exam and why a repeat scan might be necessary. Example: image quality limited due to motion artifact. Repeat study recommended under sedation if needed. Clear documentation about artifacts supports medical necessity if additional imaging is ordered. Contrast media. Contrast media are special substances used during imaging exams to make certain body parts easier to see. They help highlight organs, blood vessels, or other tissues by making them stand out from surrounding areas. Common examples of contrast media include iodine-based contrast for CT scans, gadolinium-based contrast for MRI scans. Contrast can be given in different ways: injected into a vein, IV, swallowed by mouth, placed into a body cavity, like during a bladder or joint study. Contrast helps diagnose conditions like tumors, blockages, or blood vessel problems. However, patients must be monitored for possible allergic reactions or kidney issues. In coding and reporting, radiology reports describe the use of contrast under the technique section. Example: CT chest performed with 100 milliliters of iohexol contrast. Using contrast affects which CPT codes you assign: without contrast, with contrast, or with and without contrast. HCPCS codes, Q codes, may be used to report the cost of the contrast material itself if in an outpatient setting. In the hospital, this is charged out by the radiology department. Additionally, if there are any complications related to contrast, you may need to assign additional diagnosis codes. If an artifact, like streaks from improper contrast flow, ruins the image and a repeat scan is needed, it must be clearly documented in the report. Post-processing techniques in radiology. In radiology, post-processing means using a computer to take the original scan data and create new images that help doctors better see or understand what's happening inside the body. Several common post-processing methods show up in radiology reports. Here's what coders need to know. Curved planar reformation (CPR). Curved planar reformation (CPR) takes imaging data and bends it along a curve instead of a straight line, allowing doctors to follow the path of twisting structures like blood vessels, intestines, or the pancreas. If CPR is done as part of detailed 3D post-processing that needs extra interpretation or a separate workstation, CPT codes 76376 or 76377 may apply, depending on documentation. Maximum intensity projection. Maximum intensity projection takes the brightest parts of a 3D scan, like contrast-filled blood vessels or dense bones, and projects them into a 2D image for better visibility. MIP is usually considered part of the main imaging service. Multi-Planar Reformation. Multi-Planar Reformation rearranges the scan data to show the body from different standard views: axial, top to bottom; sagittal, side view; coronal, front to back; oblique, angled views. Basic MPR is almost always bundled into the main CPT code. Only extensive reformatting that requires major additional work and interpretation could justify separate 3D rendering codes, again depending on documentation. Post-processing for coders. Post-processing is a broad term for any computer processing done after the scan to create new or clearer images. Curved planar reformation, maximum intensity projection, and multi-planar reformation are all types of post-processing. Basic post-processing is bundled in the main scan code. Advanced post-processing, requiring a separate workstation or significant physician input, may be billed separately using 76376, same session, or 7637 separate workstation. Mastering radiology-specific terminology provides a strong foundation for accurate, efficient medical coding. A deep understanding of position, projection, views, anatomical planes, regional terms, and technical language ensures precision in every coding assignment. Thanks for watching this Introduction to Radiology Medical Coding. To help you follow along and review what you've learned, I've created a free downloadable PDF with the lesson outline and keynotes. Just click the link below this video to access the free PDF now. This resource is perfect for reviewing concepts, taking notes, or studying at your own pace. You can view it on my website or download the entire course PDF, which includes all 5 written lessons, each with detailed outlines and notes that match the video content. Links below. Don't forget to download it, and I'll see you in the next lesson.